there's a lot of competition for nurses right now. So wages are up and people are being attracted to leave their jobs to go get a better paying job somewhere else. So I would say that's the number one reason. And then the second reason is just we've got nurses that are aging out. I mean, this is not unknown. This was a known problem for the last maybe decade that we are going to run out of nurses. And so nursing needs to be a good career path for young people. And so I think that's another factor here is we need to attract young nurses into the profession because we are losing older nurses.
It's a challenging line of work. What can medical centers do to attract a new workforce?
Well, there's a couple of different ways. The first one is to be a good place to work, right? To make your environment better so that people want to work there or they don't want to leave, right? So even if somebody offers them another dollar an hour or $2 an hour, if you have a really nice place to work and you treat your employees well, then they're less apt to leave. So I think that's probably number one. The second one is money. They are having to spend money to keep people. And so nursing wages are up. There's no question about that. Nurses are able to make more money. There's overtime opportunities, and so uh, hospitals can attract nurses with money and conditions.
When it comes to the nursing shortage, what's the impact to patients?
Well, the patients are impacted because there are fewer nurses on the floor. So we have a thing called nursing ratios, and in certain levels of care, whether it's medical, surgical, or ICU, there are certain numbers of nurses or numbers of patients that nurses should be responsible for. And in the ICU, you can see a 1-to-1 ratio or a 1-to-2 ratio where nurses are only taking care of a couple of patients. In the med and surgical floors, you can see nursing ratios up in the 4 and 5 and 6, and that's where it's starting to get a little dicey. Where if you have a nursing shortage on a floor and a nurse is trying to balance 8 patients or something like that, that's when a patient's going to notice.
As the pandemic seems to be winding down in many communities, what have hospitals been able to look back at and say, this worked, this didn't?
Well, I would challenge that um, assumption that we're past this. I think one of the things we learned is that the hospitals can work together when they want to. Last year, when we were having our big surge, the hospitals all worked together to manage that surge and to manage the demand, and people were transferred as appropriate, and hospitals really worked together. So that's one thing that we learned, that we can work together during a time of crisis. We also learned that we weren't prepared, right? We weren't really prepared with the nursing shortage. We've known about the nursing shortage for years, but yet we weren't prepared for this. So I think that the industry learned that it can do better on certain things, and that it has the capacity to really do wonderful things when they work together.
Jim, I want to ask you about this federal law that now requires hospitals to post costs for services on websites. How has it
Right.
rolled out here in the state of Arizona?
Well, it's a federal requirement. CMS is the watchdog for this, Center for Medicare and Medicaid Services. So this is really mostly around Medicare, and hospitals are having to comply with this. My friends in the industry have told me that, as far as they know, no one has been audited or fined about noncompliance. The federal government has been pretty slow to move into the enforcement phase here. But what they did publish just yesterday is a proposed rule to increase the penalties. So I think it's interesting that even though they haven't penalized anybody yet, at the low penalty level, they realized that the penalty was too low, and so they raised the penalty. It's still not that much money. I mean, a hospital could pay a penalty of the most of about $2 million a year, which seems like a lot of money. But for some of the hospital systems, they've decided that building this compliance mechanism so that they comply with these rules has has some expenses to it, and it's hard work. And so they also don't really want to do it. They don't really want to tell everybody what their rates are. They don't want to tell everybody what their deal with United is versus their deal with Cigna. There's a lot of worry in the industry that kind of openness could cause some more trouble than it's worth.
What do your contacts tell you about the motivation of this requirement? Because as I understand it, it's really for the patient, but is that what it seems?
Right. Well, this is you hit the nail on the head, Lorraine. this is really, it should be about the patient. It should be about patients making better decisions, having better information to make better decisions. Unfortunately, the way things go sometimes is, hey, look, we've got to comply with this rule so we don't get fined. And that's why they're doing it. And so I challenge the hospitals and the health plans to do a better job of creating tools where members can go and say, hey, look, I've got United Healthcare, and this is the procedure that you think you need to do. What's it going to cost me? And you should be able to tell right away. And I think that the industry is moving there. It's just hard work and it takes time. This rule is going to accelerate that.
All right. And some would say that's certainly long overdue. All right. Jim Hammond from the Hertel Report, thank you for your insight.
It's my pleasure. Thank you. Have a great day, everyone.